Hello, my name is Dr. Molly Roberts. I'm an integrative physician with the Institute for Health and Healing, and I'm also the president of the American Holistic Medical Association. And we're going to be talking today about a holistic approach to heart health. So first of all, I wanted to start with talking about the problem, and then we'll go into how to help the problem and how to make your heart health something that you don't have to deal with on a bigger level. So the first part is talking about heart attacks, and every 33 seconds someone dies of a heart attack. This year, 1.1 million Americans will have a heart attack. For 650,000 people, this will be the first symptom of heart disease. And I think that's a really important comment, that not everybody knows they have heart disease before they start having symptoms of it. And then for 150,000 people, death will be the first symptom of heart disease. And so this is a really important thing for us to look at from a preventive aspect. And so that's where the holistic aspect of heart health comes in. So I'd like to talk about cholesterol and plaque and how it fits into your heart health. The old way of looking at it has to do with plaque builds up in the blood vessel, and as it gets larger, it starts to occlude the vessel, and once those two ends come together, then you have a heart attack. But that's really the old way of looking at heart attacks. It's not actually what happens. What really happens is it starts out with inflammation, and so inflammation creates some problem with the blood vessel wall itself, and then some plaque lays down on the spot of inflammation, almost like a scab, like a Band-Aid, to heal that area and help it to go back to a regular flow. And so, we often think of cholesterol and plaque being a bad thing, but our bodies are brilliant. Our bodies are trying to figure out what is going to help to heal it, how it's going to stay healthy. And so there is a role for plaque, and this is one of the roles for plaque. What can happen, though, is that if you have a bit of plaque there, it can rupture. And then if the plaque ruptures suddenly, that can create a problem farther down the line and create a sudden blockage. And that's what creates a heart attack. So one of the ways your body figures out how to deal with that issue, and again, the plaque wasn't a bad thing to start out with. One of the ways your body figures out how to prevent that from being a problem is it will create a calcium cover over the plaque, and that will make the plaque a hard plaque. Once it's a hard plaque, then it's less likely to rupture. In fact, when we check a CT scan of the heart, it's one of the tests that we can do for looking at some of these issues. We're looking for that calcium cover over it. If you ever wondered why we look at a calcium score when we do a CT scan of the heart, that's why. We're looking at the calcium that's covering that soft plaque to make it hard. So there are a number of factors that are that create more risk for your heart. One of them is age. Simply, as you age, you have more risk for your heart giving you a problem. And another thing I want to stress with this is that heart health is really an extremely important thing for us to look at. Oftentimes we talk about breast cancer for women and different types of cancer, but more people will die of a heart attack than will die of cancer, and yet there's a lot of attention put toward that. So I think it is helpful, and I'm glad you're here to listen to this lecture, because this is a really important piece of what's going to keep you healthy and happy in the long run. So first of all is age. The older you get, there is more of an issue, and I could get into a lot of discussion about the differences between men and women. I'm going to be talking about that as we go along. Family history. If you have a first-degree relative who died or had a heart attack before the age of 60, then that increases your own risk. It's actually more of an issue if you have a sibling who had that problem, more than a parent. But certainly if you have a parent, it's something to look at as well. Smoking's bad for you on every level. So if I had one suggestion, it would be to stop smoking if you are doing that. It adds to heart risk, it adds to cancer risk, it causes just all sorts of problems. And so if that's in your lifestyle, it would be helpful to look at that and see if you can get it out of there. Hypertension, blood pressure, and again, this is another one of those where we think of hypertension as all bad, but your blood pressure gets stronger and your blood pressure goes up when your body needs that. And the problem is, why does it need that? And so when I'm looking at someone with blood pressure issues, the first step is to look at why that's happening, looking for the cause instead of the symptom. Because if we can figure that part out, then we may be able to make that less of a risk factor. Diabetes. The moment you have a diagnosis of diabetes, you become a high-risk heart patient. Getting sugar under control is an important piece of helping with your heart health. Stress. We often think of stress as just mind-body types of issues, and yet having stress in your life actually changes your biochemistry. So there are certain chemicals that go up, including IL-6 and certain inflammatory chemicals that literally go up when you are under more stress. So getting stress out of your life can actually help your heart. A sedentary lifestyle. I'm going to be talking about this a little bit farther along as well, but a sedentary lifestyle is a significant factor for heart risk. They often say, we often talk about your muscles going more lax if you're not using them. And the same thing happens with your heart muscle. If you're not using it on a regular basis, then it gets a little weaker. And so using your blood vessels with exercise really can make a difference. Sleep apnea. If you are having problems with sleep, it really does add to heart risk. It adds to hypertension and memory issues and all sorts of things. It raises your sugar levels, and so you are more likely to have diabetes if you have sleep apnea. So it's another one to look at. Cholesterol. I already talked a little bit about cholesterol. I'm going to talk about it more in the next slide. It's an important piece of the puzzle, but it's actually it's got a little bit of a bad rap in terms of how it works in your body, and I'll explain that in a moment. Inflammation. Inflammation, as I said earlier, is what starts the ball rolling for heart issues in your blood vessels. So it's something that I always look at when I'm working with someone to get inflammation out of their body. So in terms of how cholesterol is used in your body, your cholesterol is made by the liver, and you actually need cholesterol. It works with making hormones, with making your cortisol, which helps you with dealing with stress. It makes up a large portion of your brain matter. It is a big part of the insulation around your nerves, so it makes signals go through your nerves faster. It helps you to make vitamin D, and vitamin D is very important to just about every cell of your body. You can't make memories without sufficient cholesterol in your body. So cholesterol really is helpful. It's when things are out of balance that cholesterol becomes an issue. And another thing to mention about cholesterol, I often hear people saying, well, they're going to stay away from foods that have cholesterol in them. But that's not really the issue with cholesterol. That cholesterol that comes in an egg doesn't necessarily create more cholesterol in your body. It's a different mechanism. Where you get more dietary cholesterol is if you're eating more processed foods, certain types of fat, and I'll get into that in a moment, and sugars tend to create more cholesterol, and they tend to create the types of cholesterol that are not as healthy for you and that create more risk for heart disease. So some of the things to think about when we're looking at dietary fat. It used to be, and I've been around long enough to remember when the suggestion was to stay away from butter and to eat margarine, put margarine on everything. And now we understand that wasn't such such good advice. And so now we're looking at partially hydrogenated oils, getting those out of your body, because those tend to create all sorts of problems, including heart disease, but also cancer and things like that. So so if you were to take one thing away from this slide, it's just to avoid trans fats. And you can see that on labels. If it says partially hydrogenated oils, then that's a trans fat, and worthwhile to get out of your diet. In moderation, saturated fats can be helpful in terms of animal products, red meats, poultry, those types of things, dairy. One particular saturated fat that has been found to be very helpful for brain health is coconut oil. So saturated fats are not all bad. It's just finding its right balance within your body, I think, is the important part. In terms of using, the fats that I would want you to use would be the monounsaturated and the polyunsaturated fats. So those are the ones coming from fats that are liquid at room temperature. And that includes olive oil, peanut oils, flaxseed, most oils from nuts and those types of things. Fish has omega-3 fatty acids in it, and I could go on a long discussion about omega-3 fatty acids and then their benefits in your body. Avocado is also one of these types of fats. So those are the ones that are healthy in your system, and there's a lot of research to back that up. Many of these are contained within the Mediterranean diet that is often touted for heart health. So, so this is another slide looking at the way we used to look at cholesterol. What the study showed was that most heart attacks happened when your cholesterol was too high, and that heart attacks did not happen when your cholesterol was below a certain level, around 150. So the reaction was, well, then we must need to get everybody down to a cholesterol below 150. And so for a while, everybody was being put on statin medications to get them down there. The problem with that is, well, there's several problems with that. One is that, as I said earlier, you need a certain amount of cholesterol. And so people who are getting their cholesterol down that low can sometimes have issues with depression, because there's not as much cholesterol feeding their brain. They may have memory problems. You need a certain amount of cholesterol around your, actually around the blood vessel. It's part of the makeup of the blood vessel. And so if you don't have enough of that, you can get into a problem where you get hemorrhagic strokes. And so there's now been several population-wide studies, one in the United States, several in Europe, and one in Asia, where they found that there's actually kind of a sweet spot for cholesterol, that if it's too high, yes, you do have more risk for heart attacks and strokes. If it's too low, you have more risk for hemorrhagic strokes, and those are the ones that you bleed into your brain. And so there's that sweet spot in between, and the studies seem to indicate that that's somewhere around 180 to 219. Now, most of these we're talking about the total cholesterol, so that would be the total cholesterol. And there's more to discuss. I'll get into that in the next slide, but that's something to think about. Now, it's very different if you have heart disease. It's a whole different ball of wax, and I'll talk about that in a moment as well. But for most people with normal risk, around 180 to 219 is now my target. We may find out more as more research comes along. I always, shift things as more research comes along. But for now, this looks like a good spot to get people to. Another comment in terms of HDL. We often think of HDL being I call it the happy, healthy cholesterol, that we want to be high. And that does seem to be the case for men. Having a high HDL does decrease the risk of strokes in men. But interestingly, there was a good study that looked at high HDL in women. And what they found was that there was actually an increased risk of strokes in women who had high HDL. Now, I put on this slide needs more research, because that was one study, and it looked like a good one, but still, I think there needs to be more research to understand that more, and to see if having a high HDL really is of issue with women. So it's not that I want everybody to get their HDL down, but again, it's a balance. We need to find that balance. So these are the new guidelines that came from a joint effort by the American College of Cardiology and the American Heart Association. And as you see on this list, this is not everybody should be on statins. This is a very specific group of people that should be on statins. And that's people who already have cardiovascular disease. So somebody who's already had a heart attack, it seems to help to decrease the risk of future heart attacks. People who have an LDL that's high, around 190. People who have type 2 diabetes, as I said earlier, if you have type 2 diabetes, you have a higher, you're automatically a high-risk heart patient because there's a lot of inflammation with so much sugar in your body. Interestingly, though, they brought up that that's for people who are between 40 and 75 years of age. So if you're older than that, it doesn't necessarily mean that you need a statin. In fact, for older people, there is more of an issue with using statins because it may change issues with memory. So I'm not saying you shouldn't use a statin with someone older. I want to make it clear everybody is an individual case, but I think it's important to know what their guidelines are. And then for someone who a doctor has, figured out their 10-year cardiovascular risk, and if it's above a certain percent, 7.5 or above, then those people should be on statins as well. Now, these two organizations did not say that anybody outside of those guidelines should not be on statins. What they were saying, though, is that these are the groups that seem to be most clearly, they had the most benefit from statins, and then past that, it's more of an individual discussion. Interestingly, though, they also did discuss the importance of having a heart-healthy lifestyle in managing cholesterol and preventing heart disease, and I'm going to talk a lot more about that in the rest of this this talk. So here are some of the other markers that I look at when I'm looking at someone with, wanting to look at heart disease issues. The first part is just cholesterol, so I can look at that. But actually, I like to do a VAP test, and there's also one called an NMR test. What those do is they look at the cholesterol in much more depth. So it's not just looking at LDL, which is the one that tends to create plaque formation. It's also looking at the size of the LDL, so not just the number, but the size. Because if you think about that picture I showed earlier, if you have a small LDL, it's much more likely to lay down on a spot of inflammation. If you have what I call the big fluffies, okay, those are the big fluffy types of LDLs, they just roll on along and they don't create a problem with plaque formation. So that's another piece of the puzzle for what will make a difference. A few others are on this list. I won't go over all of them. Other than to say these are all worthwhile to check to see if there's risk. Now, the ones at the bottom of the carotid ultrasound and CT scan of the heart, I usually hold off on those unless I use those to figure out how assertive I need to be with someone in terms of getting their cholesterol down or changing factors in their heart health. So if somebody has a lot of plaque in there, then it's worthwhile to be more assertive and see if we can prevent heart disease. And an ounce of prevention is worth a pound of cure. So I often have people come in and they talk about, what diet should they be on. And I found this fantastic list of all the various diets that are out there. I'm sure there's more, but it is quite a list. And every single one of them, I'm sure, has great suggestions for why that one is the best one. And so it can feel very daunting to look at that kind of a list and try to figure out which one is the right one for you. People often pick up there is a cookie diet on there, too. So, but what I would say is actually, it is pretty cut and dry. When you look at the research that's out there, there are certain things that do make a difference in your heart health that are pretty much across the board. And these other diets may make nuances of change. They may suggest more fruits or less fruits or something like that. But in general, there's certain foods that are healthy for you, certain foods that are not. So first of all, what I would say is if you were to do one thing, I would suggest that you fill your plate with mostly veggies and fruits, and and create it with the whole color wheel. What I mean by that is, green and yellow and purple and red and white and all of those types of things. Because if you do that, the reason why those are different colors is because they have different nutrients in them. And so all of those will help to round out your vitamins and minerals and all of those that are helpful for your body. And the same thing with fruits. I do think fruits are helpful for you, and the research seems to back that up. So I do add fruits. Again, in moderation. If you're eating too much, it's too much sugar. But certainly in moderation, I think it's fine. If you're going to eat meat and fish, then make it a side dish. So don't make it the main dish. Make it the side dish. If you're eating a lot of fruits and vegetables, you've already got a lot of fiber in your diet, so you don't need to necessarily add more. I mentioned earlier about cooking with liquid fats. You can also cook with water, so that would be another way to lower the fat content of what you're eating. Drinking at least 5 8-ounce glasses of water a day, and I'm going to show you a little bit of the research around that. Does seem to be healthy, and green tea as well. And again, I'll talk about that in a little bit more depth in a minute. A few things that you may think about getting out of your diet. For some people, gluten is an inflammatory type of food. Same thing with dairy. It's not everybody has this issue, but enough people do that if there's a lot of inflammation, it may be worthwhile to get you off of these foods for a little while and see what happens. See if your inflammation levels settle down. And another comment about the gluten-free diet, oftentimes what will happen is people will then use other gluten substitutes, and a lot of those are processed or have a lot of sugar or a lot of fat or something else like that in there. And it's not necessarily a healthy alternative, so just something to think about. Decreasing sugar and artificial sugar substitutes seems to be helpful. If you're eating the foods that I'm talking about, you will start to taste the sugar content in those foods much more. I was just talking to somebody earlier today that made that comment, that all of a sudden she can taste her food again. So it really does make a difference to pull that out. You won't miss it because you'll taste it in other foods. Avoiding refined carbohydrates and avoiding processed sugar, or processed foods rather, and junk foods. That's maybe obvious, but needs to be said. So some specific nutrients to think about. Now, I put a lot on this slide, and it's really more for you to be able to look at later, so that you can sort of say, oh, what was she talking about with vitamin D, and you'll have it in there. But I just wanted to give you a little sense of some of the nutrients that have been showing up in the research lately. What I did was I looked at some of the last few years of research on nutrients to see what's coming down the pike. And so a couple of things to highlight here. Selenium is often talked about for decreasing heart attack risk, but actually the research didn't quite back that up. It does back up that it seems to be helpful for decreasing your cancer risk. So it may still have benefit in your body, but not necessarily for heart health. Now, having said that, there's a lot of research out there. We're still trying to figure out all of this. When it comes to research on nutrients, it's just getting started, and I think it's important to say that how I practice nutritional medicine is very different now than how I practiced it 10 years ago. And it's going to be very different 10 years from now. So I'm throwing this out there not for this to be the be-all and end-all and forevermore this is the truth. I think it's important to know that this is going to shift and change as we keep asking these questions. So a few other things to comment around here. Vitamin D seems to be very helpful. If you are low on vitamin D, then that can trigger some heart risk in terms of heart attacks, strokes, hypertension, those types of things. Vitamin D, that's another one where the research is still ongoing, and there's a lot coming out right now. What I would say is my interpretation of the research at this point says that a vitamin D should be somewhere around 50 to 60 nanograms per milliliter. And again, that may change as time goes on, but that seems to be the sweet spot of vitamin D, where it's not too much, it's not too little. In terms of the B vitamins, B6, B12, folic acid, those are very helpful for heart health. And there are some people who have a problem with how they process these chemicals. The B vitamins are often considered the stress chemicals because they help to move stress along and get it out of your body. And it's one of the ways that it can help with heart health. But some people don't process that well, or they need a certain type of B12 or a certain type of folic acid in order for it to get in. And that's a whole discussion outside of our talk, but there's a lot of pieces to that one. What I would say, though, is that it's something that should be checked out, because if that's an issue, it's an important thing to check. And it's not just checking the folic acid, B6 and B12, but it's also looking at something called methylation. And I'll just throw that word out there so that you can look into it a little bit more. But methylation is an important piece of heart health, and actually a lot of different parts of your body's functioning. Niacin has been shown to help to make your LDLs bigger. So I was talking earlier about the LDL size. Niacin seems to be one of those nutrients that is able to help make it bigger. And so it can be helpful for that. It also will help to lower cholesterol. Again, it's something that I wouldn't have you do on your own. I think you should work with a doctor who knows how to work with nutrients to help with that. Green tea extract is a very interesting one. It not only seemed to help decrease LDL, but it actually helped to heal that inflammation that I was talking about in the blood vessels. So having green tea on a regular basis, that's why I was mentioning it earlier. And fish oil, as I said, the omega-3 fatty acids are helpful for just a lot of different aspects of how your body functions. So that's important too. A couple of other comments around some dietary hints. As I said, gluten sensitivity can add to problems for some people, including for hypertension. It can also add to problems with your thyroid, which if your thyroid's out of whack, that can cause heart issues down the line. A high-fat diet in general can cause problems. And these were a couple of little tidbits I found in the research that I just thought I would pass it on. The first one I love, an apple a day truly does seem to keep the doctor away. So that one is helpful, I think, partly because it's giving you a lot of the nutrients and maybe filling you up and making you not want or not need the sugar and the other fats. So that might be part of it, but still, I love it. Apple a day keeps the doctor away. And then eating, how you cook your food really does make a difference. If you are having your fish fried, then that is not healthy. It creates something called ages. It actually ages you. It's glycosylated end products that can cause more inflammation in your body. So again, this is another slide just to have you read later, but just wanted to throw that in. Garlic and onions, though, I do want to comment on. Garlic and onions, they're called the allium vegetables, and they seem to help with lowering cholesterol and blood pressure, but they also help to ward off cancer, and I've heard they help to ward off vampires too, but they are very healthy for you. So adding garlic and onions can be a good spice for your foods. Now, in terms of exercise, there's been some really great research looking into exercise, and one of them had to do with being overweight and exercise. And what they found was that moving on a daily basis, exercise on a daily basis, was more beneficial for your heart than losing the weight. So you can potentially have a little extra weight on you, but if you are fit, then you are helping your health. So just to make that comment. And this was an interesting study I found in relationship to, heart drugs versus exercise. And they looked to see, this was one of those meta studies where they looked at a whole bunch of different research studies to see which to recommend when somebody comes in with a particular problem. What they found was that exercise had the same benefit as heart drugs for people who had a heart attack, That's a secondary prevention of heart disease. That's what that is. Or, someone who has coronary artery disease in some other way. And for the prevention of diabetes. So they were the same results using the drugs versus the exercise. And I was talking to somebody the other day about which they should use, and one of the issues is you have side effects with heart drugs. I'm not saying you shouldn't use heart drugs, but there are side effects, and you need to be able to weigh the benefits and the risks. Whereas exercise in general, other than injuring yourself, can be very beneficial. No real side effects other than moving oxygen around your body. So that's something to think about if you're on the fence around heart drugs. Maybe getting moving might be another option. More effective, when exercise was more effective than drugs, that was for stroke patients. And for when drugs were more effective than exercise, that was for heart failure patients. The diuretic, getting the fluid off, seemed to be more effective than exercise. However, what they found in that same study was that diet really did make a difference for heart failure patients, that they had a better quality of life when they were paying attention to diet and making some shifts in that. So exercise really does make a huge difference. A sedentary lifestyle increases your risk significantly of heart disease over time. So a sedentary lifestyle is actually one of the 5 major risk factors for heart disease. So if this is something that's not part of your regular routine, it might be worthwhile to look at that and see. Now, one thing I often comment on with exercise is it needs to be fun, or you're not going to do it on a regular basis. So it doesn't have to be something that is making you miserable every day. It needs to be something that gets you into a moderate level of activity. And what a moderate level of activity means is about 30 minutes where you're huffing and puffing a little bit, but you can still speak in full sentences. And what's nice about that criterion is that it's going to be different for everybody depending on their fitness level. So as you get more fit, then getting to that place where you're huffing and puffing but still able to speak in full sentences means you'll be pushing yourself more. And at the beginning, it will be with less activity. So it follows you along as you get more fit. And what they found with exercise is that it really the benefits of it are significant. 30% reduction in mortality for people who went into cardiac rehab, and it was the gains were most beneficial to those who were not fit at the beginning. So if you're thinking, well, I never move around, I haven't moved around, and how is this going to help? It actually will help significantly. It'll actually help you more than someone who is more active. So every little bit really does make a difference. Even gardening, there was a great study looking at that. Gardening seemed to decrease not only the risk of heart attacks and strokes, but also helped with mood. Gardening was shown to help decrease depression. So there's a lot of ways that you can move. It just depends on finding the thing that works for you that you can do on a regular basis. I guess one other thing I would say around this is that if this is not a habit for you, it's really hard to add a habit to your day. What's much easier is if you tack it onto another habit. So what I would suggest is pick something that you do every day. It may be brushing your teeth or watching TV or whatever it might be, and tack this onto that. So don't brush your teeth until you have exercised for 30 minutes, or have it be that you can only watch TV if you're on your recumbent bicycle at the same time, or something like that, where you use the habits to trick yourself or train yourself into creating a new one that's healthy for you. What you drink matters as well. We've talked about eating, we've talked about exercise. What you drink actually matters too. And I talked about the 5 8-ounce glasses of water. That had a significant shift for people in terms of their heart disease. And you can see on the slide, 54% decreased risk of fatal heart disease if you were drinking that much water. For women, it was a 41% decreased risk. That's pretty significant. I don't know how too many meds that will get you to that level. So, if you're not drinking water on a regular basis, it's another thing to look at. It will also help with your kidney functioning, and the kidney functioning, if that's low, then that can add to hypertension. So, your body all works together on this, so it can help on lots of different ways. The green tea also seemed to make a difference, green or black tea. And as I said earlier, it's because it seems to help decrease the inflammation in your system. But it actually is a pretty significant amount. 26% decrease in strokes and heart attacks is pretty significant. The ones in the middle here are ones that did show benefit in studies, but I put them in the middle because there's also a downside to these. So drinking alcoholic drink, basically they said more than one alcoholic drink a week seemed to decrease the risk of death from heart disease when compared to those who didn't drink. However, it's sometimes hard to stop at one a week, and so if you're having a problem with alcohol, or even if you're drinking it more than, I think it's 2 a day for men and 1 a day for women, it can add to blood pressure problems. It can add to diabetes issues. It can decrease your sleep. So it's got a lot of downsides as well. And the other comment I would make about alcohol is that some people use it as their way to relax. And that may be helpful, but if there's another way to, another skill that you can learn to help you to relax at the end of the day, it may be a little healthier than alcohol. So I don't want to downplay alcohol. There's benefits to it, but it's one of those everything in moderation. Same thing with coffee. Coffee does seem to help to open up your blood vessels, and so it does seem to help with that. And because it's making your heart pump more, it may be helping with heart failure as well. But it can increase blood pressure for some people. It can increase arrhythmias or heart palpitations for some people, and it can make some people have difficulty with sleeping. So those, again, in moderation, it's probably fine, and there is research to back up that it's fine, but just be careful with it. And then the things to avoid, the drinks to avoid would be colas and soft drinks, because they have all sorts of other issues related to it. They do seem to increase your risk of strokes and heart attacks, vascular death, and also diabetes. So mind-body interactions are really important. I mentioned earlier about how your mood actually changes your physiology. So, sometimes people think of this as something kind of woo-woo and not as important as all the rest of it because it's not a pill or a supplement or something like that. But actually, this is extremely important. It really makes a difference in your overall health and with this discussion in your heart health. So it is worth looking at to see if this is something for you to pay attention to. And so meditation can be very helpful, yoga, whatever gets you into that relaxed state. And this is another one like exercise. You got to find what works for you. So meditation is not for everybody. For some people, they are they get more benefit if they're moving around more. And so for those, more exercise might help. For others, something I call a shaking meditation might help. Just to move your body and get some of the excess stress chemicals out of there can help. And so it doesn't always need to be, a particular way that you've seen someone else do. It can be your own. Laughter helps. Forgiveness, it's some interesting research on forgiveness that it's actually more beneficial for you than it is for them. So if there's someone that you need to forgive, it might be worthwhile to look at that issue too. And community, family, all of those are very important. Spirituality. Now, there's spirituality related to a religion, and there's spirituality related to that feeling of connection with yourself and the world around you. They both seem to be helpful for heart health, and there's some good research out there to back that up. There's interesting research around community. What they found is that having a supportive and loving community can possibly make more of a difference than all the lifestyle and exercise changes that we're talking about. So another thing to look at if that's something that's missing in your life. I brought up the telemonitoring and the monitoring. some interesting research around this. If those people who used a food diary or some way to measure their steps or those types of things, or that the telemonitoring is more things like letting your doctor know about your blood pressure or having a community on the internet that helps you with some of this. That seems to be helpful, so it's worthwhile to bring up. It may give you more of a sense of support while you're making some of these changes. The things on the bottom half of that slide are looking at the aspects that are not so healthy for your heart: anger, stress, depression, and some interesting research around having high financial debt. Seems to be bad for your health. And maybe this isn't surprising to you, but I think it is important to say, because sometimes some of these issues get lost in the shuffle while we're looking at your blood pressure and your cholesterol level. So sleep. Sleep is incredibly important. This is how your body recovers from the day. It's at that time of the night while you're sleeping that all your blood vessels and your muscles and everything regenerate. And so if you're not getting enough sleep, that can be a real issue. Sleep apnea has been shown to increase your risk of heart disease, but it's not just sleep apnea. If you're being woken up because your partner has sleep apnea, or you have animals in the room that are waking you up, or if there's noise in the background or something like that, whatever makes it so that you're not getting deep sleep is likely creating a problem in your health and should be paid attention to. We need to look at it. Getting less than 6 hours of sleep a night was linked to a 4-fold increase in mortality, and this was all-cause mortality. So that's big, and we live in a culture that doesn't honor sleep, so I think it's worthwhile to mention it. Improving sleep tended to help with hypertension, and I threw in this slide also. Sleep is when your body makes cholesterol, and again, I do want to say cholesterol is not the bad guy. It can be the good guy in moderation. And when I wanted to talk just very briefly about getting them while they're young, and because this is such an important piece as our next generation grows up. Obesity is a big issue right now in children, and so that is there's some statistics looking at that this may be the first generation that does not live longer than their parents, and so that's something that I think as a society we need to look at. But there are a couple of other studies out there that I just wanted to throw in terms of getting them while they're young. One was very interesting. It looked at women who were pregnant who did not have enough protein in their diet, and it turned out that when their children became adults, they had more of a risk for hypertension. So there is a role for protein in the diet. Those who were college binge drinkers tended to have vascular changes that looked like early cardiovascular disease. So you can't get away with it even in college. So that it makes a difference. A few other things that are often not discussed are, and I just threw a few in here, and again, you can read over these later, but teeth cleaning, dental health is a very important piece. And so there are some good research articles or research studies looking at this, showing that those people who had a lot of problems with periodontal disease had a significantly increased risk of a heart attack. So it's something to pay attention to. Getting a flu shot actually does decrease your risk of generally decreases the risk of heart attacks by about a half. Being in the sun. This is one of the reasons why I often suggest that people go out in nature. Well, for many reasons, but this is one of them. It's not just the vitamin D. There are other reasons to be out in the sun and commune. In terms of air quality, pollution, they're finding this in more depth in China right now, and also certain cities in the United States also have this issue. And working shifts is becoming more and more of an issue. Lots of research around this. It does increase your risk of heart disease. And I just wanted to throw in a comment about the differences between women and men. We are not made with the same biochemistry. There is a difference with our hormones. And so women don't tend to have the same symptoms when they're having a heart attack, the chest pain or the pain going down their left arm or up to their jaw. They're actually more likely to have symptoms that almost look like the stomach flu, nausea and lower abdominal pain. So it's something to consider if somebody's having those symptoms. It might be worthwhile to get it checked. It's often missed for women. The other thing is there have been, so far anyway, no good studies showing that statins are effective for women. And so, they don't seem to decrease the risk of heart attacks or mortality or anything. So for whatever reason, and I don't think we understand all the reasons yet, so far it doesn't seem like they help. But they do seem to increase the risk for diabetes, and they do seem to increase the risk for memory problems and musculoskeletal issues. So it's always, you have to weigh the risk versus the benefits to see if it makes a difference. I do want to stress with this, I'm not saying that I'm against medicines. I act as a bridge between Western medicine and integrative approaches, but I do try to bring in the research to look at when one is maybe more helpful than another. Another thing is high cholesterol didn't seem to be as much of a risk for women as it was for men. Interestingly, though, having migraines with auras did seem to be a risk, particularly if oral contraceptives were used to treat it. Risk for strokes in particular. So it's something to consider and to take into account when we're looking at all of this. So here are my take-home messages for a healthy heart, and I talked about these throughout throughout this discussion, but I just wanted to put it all into one little package for you. So if you walked away with one piece of paper or a slide, this is the one. And what I would suggest is that you take this list and you look to see which are the things that you're doing well right now on this list, and just check them off and pat yourself on the back that you're doing those well. And then anything that is more out of balance, it might be worthwhile to put that on your list of things that you want to pay attention to and make some shifts. And keep a diary. If you're not drinking enough water, maybe keep a diary like I was mentioning earlier, so that you can remind yourself to have the 5 glasses of water or whatever it might be among this list. And so I saw a really nice Irish blessing, and as you can guess, I'm Irish with a name like Molly, and I just thought I would leave you with this. May your pockets be heavy and your heart be light. May good luck pursue you each morning and night. And my name is Molly Roberts. I'm with the Institute for Health and Healing in the Marin office in Green Bay, and may your heart be ever so light. Thank you.